Nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups and communities, sick or well, and in all settings. Nursing includes the promotion of health, prevention of illness, and the care of the ill, disabled and dying people. This is why nurses are regarded as critical cadres in the health profession. But without passion, it may actually be a daunting task. Marion Atwizuchire of Bethany Women's and Family Hospital and Merus Mutiaba of Mengo Hospital were both attracted to the profession because of the smartness of the nurses in the areas they grew up in.
When I was growing up, we were staying near the hospital. That is when I was in primary with my auntie. And I used to see the nurses. They looked smart for me. And the most thing that I liked on them is the cape.
I used to come to this hospital when I was young, and the way nurses handled me, they were very kind, very smart, and very helpful.
Atwizuchire has been practicing for 7 years now, and Mutiaba, on the other hand, is now a principal nursing tutor with 45 years of experience on her shoulders. The two started out in public facilities, but the experience differs.
By that time, we had the equipment and the supplies we were using, and so I felt very comfortable when I was working in Masaka Hospital.
As someone who was fresh from school with all the skills that I wanted to reach to the people who are in need and offer my best services, but you would be limited. You receive a mother who is in labor, but you do not have what to use.
They both agreed that the welfare of nurses needs to be improved in the country.
Motivate the nurses, increase their salary because their working conditions are really not good.
One gets motivated to work very well when all the supplies, the equipment, everything needed to work is in place.
Unlike Mutiaba and Atwizuchire, who are now working in private health facilities, their colleagues in public facilities have resorted to industrial action, demanding for, among others, lunch allowance.
Lunch allowance currently is a top-up. We are not requesting anything new. We are looking at increment of 12,000 to make 15. We are following the proceeding of the budget. We found that that money was unfunded priority. So if we say that now, if the money is unfunded priority, then nurses should not continue because we are not priority in the country. But we emphasize that maternity and casualty, children's ward and theatre should continue working with the nurses there.
According to Cherop, salary and allowances are not the only troubles demotivating the nurses.
Other administrators don't allow them to go to school. Others don't allow them to go for annual leave. And you find that the nurse becomes so annoyed. The intimidation of the politicians. The politicians come and intimidate our nurses, threaten our nurses, others arrest nurses without any problem. So those kind of life attitude of place of work. Then of course they have issues of traveling long distances from the place of work.
It is true. Most of our facilities do not have adequate accommodation for all staff. But what we do, especially the lower units, at least we give priority to the midwives and the nurses that are attending to emergencies are the ones that are offered that priority.
Uganda has about 66,000 nurses. Of these, only 26,000 work in government facilities, and the ratio of nurse to patient is 1 to 10, short of the World Health Organization recommendation of 1 nurse for every 2 patients. Every academic year, nursing schools around the country produce about 5,000 nurses. So what explains the shortage in government facilities?
We recruit based on our structures, and that structure is something that right now we are working on. We are involved in restructuring the entire health sector, starting with the national referral, regional referral hospitals, general hospitals, health center 4s, and health center 3s and 2s. Right now, the limiting factor, even where they don't have enough staff, it is because of the wage that is provided. The wage, you find that there's some limitation on the wage. You cannot employ more people than you can pay.
Walter Mwesije, NTV.